All right, welcome to the Talking HealthTech podcast. My name's Nathan Moore. I'm one of your THT community ambassadors, and I'm here today to interview Elaria Paul from Global Health MasterCare. Hi, Elaria.
Hi, Nathan. How you doing?
I am fantastic, of course. Actually, you know what? Before we jump in, I do want to say I did my due diligence of a bit of LinkedIn stalking and website. And the thing I need to say, kudos for the prominent display of the Talking HealthTech membership badge on your website. That made me smile. That was fantastic. So look, let's get into it a bit. So could you start by introducing yourself and a bit of your background, and then give us a bit of an overview of Global Health MasterCare?
Oh, absolutely. So my name is Elaria Paul, as you've kind of already introduced me as. I am a product portfolio manager for our consumer engagement platforms here at Global Health, and have been with the company for about 3 years. But in another life and a continuing life, I am a pharmacist, still working at least casually, if not part-time, to keep my registration going and to make sure that I can really give back to the community.
Oh, fantastic. Such an important piece, and something that so easy to get disconnected from the end use of some of these things. So no,
absolutely.
That's fantastic. So look, Global Health MasterCare, what is it? What do you do?
So Global Health is a proud Australian-owned company who have been in the industry for more than 20 years. We specialize in providing health tech products within the hospital and community health sector, mainly to ensure that we can actually connect our clinicians with their consumers.
And so I guess, when I was going through the briefing notes on things we were looking at talking about today, was a bit about the digital front door, and it seems to be somewhere you're leading into a bit. So, you know, not the first company we've talked to about this concept, but, you know, for our listeners who may not be familiar with it, and with your global health slant, you know, what is a digital front door, and why is it so important in healthcare today?
In summary, a digital front door is a all-in-one patient engagement solution, which is designed for healthcare delivery businesses. Typically, it's a platform that allows for online appointment scheduling or smart forms or video consultations, secure access to personal health records, things along those lines. And the entire point of a digital front door is to streamline patient interactions and provide a single platform for managing various healthcare needs and improving overall convenience and communication between clinicians and their patients.
Such an important piece, and it's becoming more, you know, as patients want more control of their data, more say in what's going on. It's obviously such a big demand on systems that often can't take care of it in a lot of our systems. You know, some areas are doing it really well, but there is obviously a gap in the market around it. So why don't we dig a little bit deeper in how you actually tackle this out of Global Health? So how do patients actually interact with this directly? You know, do they manage their own appointment times and payments? Like, what sort of processes have you got in place for that?
Yeah, so look, digital front doors are really designed to ensure that patients have the empowerment or the ability to manage their own healthcare and to not be met with consistent stumbling blocks or barriers in accessing the healthcare that they need. So, for example, in our digital front door, we like to ensure that we provide our customers, which are the healthcare organizations, the ability to advertise their online appointment booking availability, but one that integrates directly with their practice management solution so that I, as a patient, am confident that when I'm booking an appointment online, I'm not going to rock up at the time and be told, oh, no, sorry, you've double booked, you're going to be half an hour later. So it gives real-time appointment availability, which allows for the cancellation and rescheduling workflows to also be implemented, and therefore ensures that the next patient coming in after me is seeing the real-time appointment availability up front without being concerned the same way that I would have been at my appointment time. Yeah, no. But it's not just about the appointment availability. It's also ensuring that clinicians are able to access their patients in a more convenient way in a modern society like today. So I don't know about you, but I am supremely frustrated most of the times because my general practitioner does not do teleconsultations. And I work 9 to 5, right? And by the time I finish work, they're closed. So being able to provide video consultations or teleconsultations for clients, I think, is imperative in the way society is at the moment.
Okay, so, I mean, you've brought it up, so that leads us really nicely into the next part. I mean, you mentioned that Telly Health. How does that integration occur within your platform?
At the moment, within our platform, we have teleconsulting capabilities embedded directly in there, which allows for secure consultations, which very much like our podcast right now, allows for audio visual, as well as a document share and a chat and a whiteboard and a screen share. So it really ensures that any video or teleconsultation that is hosted directly in the system is quite in depth and ensures that accurate or safe practice is being followed during teleconsultations as well. And it not only is, I'll just mention that it's not just, it's about ease of flexibility for everybody. So obviously one-to-one is there, but it also allows for one-to-many consultations.
You know, that and it is something I've seen used with some success before around that, the group consults, family conferencing, those sorts of things, such important stuff. I wanted to unpick a little bit. You mentioned about, whiteboards and chat function, and from my notes here, I see you mentioned sort of forum places like that. That is a bit of a newer one, for like a bit of a differentiator that I haven't seen in some other platforms. So why don't you unpack that a little bit, how they're used and what the intended outcomes are for those processes?
Well, yeah. So a digital front door is all well and good in terms of providing base needs, but the real differentiator or the real important part is actually engaging with the community. So for us, we were ahead of the curve when it came to digital front doors. We've had it going for a very, very long time, but engagement is a cornerstone of any digital front door. It's imperative that a digital front door ensures that I not only have access to my clinic, but I'm also receiving value and added benefits myself as a patient or a consumer. Things like educational pieces or events or chat forums, which can be moderated as well by the organization. These features ensure that I, as a patient, have access to a cohort of individuals experiencing similar issues as me, so that I know I'm not alone and that I have a community that can actually support me through what I'm actually going through. So we find that education, events, and chat forums in a digital front door, it really fosters patient engagement and it offers more valuable information and interactive platform for learning and discussion.
So that engagement piece such an important consideration, and maintaining that engagement, like you say, value adds not only to the end user but the facilitator, your clinicians, your administrator, all of those.
Absolutely.
I mean, one of the challenges I've seen, I've spoken to a lot of different vendors in this space, and Telly Health, it's one of those double-edged swords. Some people really love the idea, and that idea of providing consumers with the option, like the choice, that's a big part there. But there's also a whole question around that digital literacy, fluency, technology literacy and fluency. How do you approach that when you've got, a certain proportion of the community that these technologies might be foreign to them? Internet connectivity issues. Like, what does that look like for you guys? How do you support that education piece?
So we try to ensure that clients or patients have access to more than just teleconsulting. I appreciate that it's not for everybody. Yeah. And it's not just that it's not for everybody. Like my GP, some clinicians just don't offer it. Yeah. So in instances like that, I as a patient still need to be able to access my healthcare. I need to be able to access my doctor. So the ability to ensure that as a patient, I'm not only booking for teleconsultations and having them, but for in-person consultations or RSVPing to an event, things that are significantly simpler than necessarily knowing the technicalities of booking for an appointment and then going to the link and then clicking on the link and then joining. And is my camera working? Is my mic working? Why can't I hear you? Why can't I see you? That can all be bypassed by allowing for them to book in-person appointments or telephone appointments and still allowing for them to access their healthcare because they can see you and find you online without having to physically pick up the phone or wait on hold and call.
Waiting on hold thing, such a common thread.
Up the wall. It truly does.
Oh, fantastic. All right. Well, look, I guess just in continuing the conversation here, let's flip from the consumer side to the clinician side. How does the platform help reduce hospital admissions, improve home care? Like, how do you support that for the clinicians delivering the care?
It's funny you ask, because I think a lot of clinicians at a lot of healthcare organizations sometimes don't see the benefit for themselves. But in reality, there are so many immediate benefits for clinicians and organizations who choose to use a digital front door. And this ranges from patient care to streamline workflows to a surge in their own profitability. Because effectively, by increasing accessibility to healthcare services through a digital front doors, for example, online appointment and teleconsulting capabilities, it results in unnecessary hospital admissions declining. And we reduce the burden on our hospital systems because we've increased access to healthcare within the community. So digital front doors provide an opportunity to improve care in the home through access to multidisciplinary healthcare within the community. And that's only one element of it, right? So that's literally just being able to access it. But hospitals and community health organizations alike, they all require data collection from their clients or their patients, often prior to an actual consultation occurs or prior to an admission. So the use of our smart forms in a digital front door or a digital front doors form capacity, especially if it integrates with a PAS clinical solution or practice management solution, it reduces the administrative burden and it minimizes the risk of human error with data entry for both clinicians and admin teams. That then, in turn, frees up time and resources to ensure that they're actually being dedicated to the more important aspects of healthcare management and streamlining their workflow there. So by increasing an organization's access, or rather their patients' access to them and streamlining their workflows, they're in turn increasing the potential in attracting more patients or referrals and ultimately increasing their profitability and reducing their bottom line.
No, fantastic. I mean, that whole, was one that I don't want to deep dive too much into the technology, but on that interoperability front, like you mentioned, those integrations with PAS, practice management software, notoriously challenging at times with smart forms and, the ingestion, write back, all of those things. I mean, do you want to give me a bit of an overview of what sort of integrations you have or how you've tackled that?
Digital front doors need to be interoperable. Otherwise, they only increase the burden for clinicians and consumers alike rather than actually alleviating it.
Yeah.
So in our case, we have ensured that our digital front door is embedded with HL7 secure messaging, and it uses FHIR APIs to ensure that it's interoperable not only with our solution set, but with any clinical practice management solution that adheres to those health tech standards. Yeah. We don't want to be, like I mentioned before, we don't want to be causing duplicating of manual labor. We're trying to streamline it and reduce those workflows, and we can't rely on sending data across the internets in an unsecure fashion. It needs to be encrypted. It needs to meet those HL7 standards. Yeah,
no, fantastic. And I mean, it does feel like we're slowly getting that way where we are seeing some of that standardization, whether it be through terminologies, API, all of that.
Conversation is happening, right?
Yeah. Feels like it's been happening for a while, but we're seeing some movement.
As long as they're talking, it's a good start. We just need them to actually progress further.
I mean, okay, so you've talked about the clinician benefits there and, the administrative management burden, increasing profitability, access, all of that. When we unpack a little bit the consumer benefits here, like what are some of the consumer pain points that you feel you're addressing? What's some of the good feedback you've had from people using these platforms?
So I always like to talk about my experience as a healthcare consumer. And there is nothing, I think, that frustrates me more as a patient or a healthcare consumer than the inability to access my clinician or their services when I actually need them. I shouldn't have to be sitting on hold for half an hour trying to get through to speak to the receptionist to actually see if my doctor even has an availability in this next week. Like I said before, I work 9 to 5. By the time I'm done, they're closed. I need to be able to fit in my health into my schedule and prioritize my health because that's the most important thing, right?
Yeah.
So if I can get a hold of my practice online and I can see their real-time availabilities and book an appointment for myself, that for me is a really big win. And it means that I can get access to my healthcare because it's right there for me. I'm not having to jump through hoops to get there. But having access to a digital front door, it ensures that my life becomes easier. In a modern world where everything revolves around instant gratification, especially with millennials and the following generations, everything needs to be done right here, right now on my phone. I need to be able to access these systems on the go, in the train, wherever I am. So if it's not happening immediately, as a consumer, I lose interest. So with an online platform, you draw in people who could generally be time poor or adverse to asking or receiving healthcare because there are too many options that they can't filter through. So having that digital platform, it really increases the ease with which a patient can come to you as an organization and actually receive the healthcare that they need.
Such an important point. And I think it's not just about the timeliness, but also just the expectations of user experience, user interaction, like what they'll, they used to talk about the iPhone effect and that, that bar was set. And I think as a society, not only are we after things, in real time, but also, why is my healthcare journey not as streamlined as my banking or my Netflix, feed? Like these interfaces are so streamlined and so effective in so many cases. Why isn't that the case for our healthcare, which is arguably the most important thing?
Absolutely.
So I guess it's a very complex system with lots of information, legacy, moving parts and all of that, but it sounds like we're getting there.
We are. Healthcare is always the last one to actually adopt technology and to roll with it. There's always so many concerns about data sovereignty and safety and accessibility and all of those complex but imperative aspects. They need to be addressed. But if healthcare doesn't get on board, then as a society, we're kind of going backwards.
So, we talked a little bit about some of the feedback and the experiences. And how does global health, how do you ensure continuous improvement? Like what feedback mechanisms do you have? Is it a regular review cadence? Like what do those sort of processes look for that improvement pipeline?
We've got a number of different things that we actually do. Obviously, being a health tech company, we've got our fair share of devs and QAs and all those people. So not only are we consistently doing feature upgrades, but we're also ensuring that we're constantly doing penetration tests to ensure that security is there, that our products aren't vulnerable, I think is a word that I was after, not viable, vulnerable.
Very different.
They're very different. Ensuring that our products are not vulnerable through consistent penetration tests, but we're also engaging in regular user groups with our existing clientele. We'd like to hear their feedback. We'd like to show them the new features that we're creating, get them in some cases to get a play environment, to play around with it and tell us what they think needs to be improved for their journey, for their workflow, for how they actually do their jobs. Because at the end of the day, yes, we provide them with a software, but the software needs to be able to meet their organizational needs. Otherwise, it's futile, right?
Yeah.
So we like to work closely with our clients. We like to hear their needs, hear their pain points, and that is what feeds our direction in terms of the development pipelines that we actually put forward.
Fantastic. And it feels like, it sort of leads me to the next question. We're in such a rapidly evolving time at the moment around technologies. Not to just throw it in because it's a hot topic, but how is Global Health MasterCare adopting to these emerging, AI, emerging technologies, like just these expectations? Is there anything interesting that you've got in the pipeline, or how do you approach that as a business when the landscape changes, almost daily now?
It's a moving target, isn't it? Yeah. It's something that we actually take as a matter of high importance. So we have been in conversations quite a bit in terms of how to implement AI, and to an extent we already do. So we have capabilities within our software. We obviously have a wide variety of software. We have capabilities in our software to ensure that drug data is being auto-populating through drug databases, and we allow for coding. We allow for multiple different elements, which are AI to an extent, to be able to ensure that our clinicians and our patients are actually getting the most out of a solution. And that's not necessarily just with medication. It could be with dictation. Simple things like that make a very big difference. But AI is a forever progressing and moving target, but it's one that we as an organization, we're quite keen on dabbling in further than we already have to ensure that we're optimizing the workflows for all of our customers.
Fantastic. And that transcription piece is just one of the, I don't want to call it low-hanging fruit, but just, it's My background's CNI. I know the burden of documentation. Like it's one that's close to my heart. So it's great to hear that for the target. All right. So look, just in wrapping things up, I mean, what's next for Global Health MasterCare? Is there anything on the horizon you'd like to flag, or anything that might be interesting for our listeners?
Look, we've got a lot going at the moment. We're ensuring that our SaaS solution is going to be ready, available for all of our customers, whether that be within the hospital or the community health or the allied health, or the GP or the specialist world. So our modular SaaS solution is already available now for many cohorts and is consistently evolving. So that's always really exciting. But more importantly, our digital front door is forever increasing in its feature set, and it's improving that patient engagement. So at the moment, we are close to finalizing our informed financial consent piece, which will allow for hospitals, for example, to not only generate their fee estimates after doing their online eligibility check, but to send that directly to the patients, for patients to then consent electronically, that consent to go back, and maybe even charge them for their gap fees up front via our secure online payment gateways. So there's a lot that's happening. It's forever moving, but it's a rapid development section. So very much stay tuned, because in the next few months, there's so much coming.
Amazing. Well, look, thank you so much for your time, Elaria. I've learned a lot. I hope our listeners will as well. And all the best. Thank you.
Thank you so much, Nathan. I appreciate it.
We hope you enjoyed this episode of Talking HealthTech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.